Hello folks, my name is Dr. David Cullum with Synergy Wellness in New York City, and we specialize in treating disc herniations, disc injuries, disc bulges, fissures, degenerative disc disease, spinal canal stenosis, sciatica, anything related to the spine and disc. But we're going to show you how we treat a disc herniation. Bill here has allowed us to use him as a guinea pig. Bill has, can I say it, Bill? Can I tell him what's going on with you? You can. All right. So Bill here has multiple disc herniations in his back. We all have 5 discs in our lower back, okay? Now, some of us have more, some of us have 6, but Bill has 5 discs like most of us, and of the 5, 4 of them are either bulged or herniated. And of those 4, there is pressure on the lateral recess of the spinal column in his lower back at multiple levels. And the lateral recess is the hole on the side of the spine where the nerve exits from the spine. And the lateral recess, when it's closed up, that means there's pressure on that nerve. So it's basically a nice way or a fancy way of saying you have a pinched nerve. So Bill here has several pinched nerves. And a couple years ago, we saw him for some really bad sciatica. If I remember correctly, you had sciatic pain down the left leg, right? Yes. Correct, I mean? All the way down. Yes, and now it's down his other leg, correct?
Yeah, more in the front.
More in the front, for those of you that can't hear him. But the reason why he's having the pain down the leg is because there's pressure on in the lateral recess where the nerve exits from the spine. So he also has a disc fissure, and that's something I want to talk to you guys about. A disc fissure is when the disc in between the bone cracks. So a fissure is can be also called a herniation. Typically when it cracks, fluid leaks out, okay? But it doesn't always have to be the case. You can have a degenerative disc or a dried up disc and have a fissure or a crack. Fissures are difficult. Fissures can be very symptomatic. A fissure, if you have a disc fissure, you can just kind of twist in a certain way and really feel it. It's sharp, it's stabbing pain, and there doesn't necessarily have to be a rhyme or a reason for you to aggravate your back. I mean, that goes, I think, with any disc injury, but especially with disc fissures. So we've already kind of tolerance tested Bill here. We know what aggravates things and what doesn't. At this point, after seeing him for so many years, we're now letting the traction in. Now, traction can be symptomatic for some people with disc fissures. It doesn't cause any increase in symptoms for Bill here. We're now going to go in and do some flexion distraction technique. A lot of people who have disc injuries say, oh, I went to a chiropractor, it never helped me. Okay, but did you have this technique done? And most of them say no. So not all techniques are created equal, and it just depends on the injury you're going through. But I will tell you this, if you have spinal stenosis, neuroforaminal encroachment or a pinched nerve, sciatica, any pins and needles or neuropathy down into the legs, or if you have any kind of disc injury, any kind, Cox Flexion distraction technique is the gold standard, and I will argue with anyone about that. It is hands down the gold standard when it comes to treating disc injuries. So if you go to a chiropractor and he puts you on your side and racks you and cracks you and sends you on your way, that is not Cox Flexion distraction technique. That's another technique, and I'm not saying it doesn't work. It does. But the gold standard is Cox technique for any type of disc or chronic spinal injury. So we're going to show you the Cox technique here in a minute. What I'm doing here is loosening up all the fascia around the spine, which are only acting as a compressor, right? They're compressing his spine. So we want to just loosen up the glutes, loosen up his QL muscles along the spine, and then we will begin the Cox Flexion distraction process. It looks really gentle. I've done so many videos on this technique, and a lot of chiropractors around the country have the table but are not necessarily certified in the technique. It's not the same thing. You can have the table, but if you don't know what you're doing, you're not going to get the same results. So again, if you have a disc injury and you saw a Cox technique provider, make sure he's certified or at one point has been certified. They make you get the new certification every 2-3 years. That's not necessary. As long as he's been certified once, that is fine. Okay. Now, you can go onto their website, Cox Technique, spelled with a C at the end, and you can try to find a certified Cox Technique practitioner in your zip code. If you're in New York City, you don't have to look. We're right here in Manhattan. You can come to us. I would assume there's probably a few certified Cox Technique practitioners here in New York City. I just know of myself. Sorry, folks. Bill, how we doing here?
We're doing good.
All right. Yeah, that's sensitive right there, isn't it?
Yes, the previous spot more.
Previous spot more? Okay, take a deep breath in. We'll go back to that previous spot. Now, we've had all sorts of people on our YouTube channel. We just did some videos of some contortionists. Can you believe it? So it's like a chiropractor's worst nightmare when you think about it. Contortionist, a football player, anybody that's got UFC fighter, it's, just a lot of injuries to deal with. But yeah, we had a few contortionists. Now, Bill, you used to be a clown, right?
Oh.
No, you were not a circus clown? Oh, okay.
Was that me?
Yeah, I thought for some reason I thought you were a circus clown at one point, and that was your career. But I'm mistaking you for another circus clown.
For another clown.
So there you have it. We have all walks of life that come into this office because we're in New York. We've had clowns, we've had contortionists, you name it. Yep, we've had UFC fighters in here. You name it. We've had it all. Okay, so Bill is not a clown, folks. Okay, sorry about that, Bill.
Well, don't get carried away.
You look like you could make for a funny clown, though. And when I first began my career, I saw a lot of wrestlers from the WCW and Spice Girls, and yeah, they helped me get through my residency. In the very beginning of practice, I started working with a lot of wrestlers, so that's another tough job, and a chiropractor's worst nightmare too, dealing with wrestlers. They have so many injuries, being body slammed all day long.
My super was Tony Rambo.
Oh yeah?
Yeah.
The wrestler?
Mm-hmm.
Tony Rambo. Wow. That was your super.
Yeah.
Wow.
20 years ago.
That's incredible. Was he limping around? Did he have all sorts of injuries and stuff?
Oh, he was a bulky guy.
Was he?
Oh, yeah.
Wrestler gone superintendent, huh?
He did a little of each.
Okay. That's a neat story.
Yeah, he was a great guy.
Is he still the super of that building, or?
No. He went way uptown 20-something years ago and
Okay.
lost track.
All right. So if you guys can guess what Bill does for a living, don't tell him, Bill. He's not a clown, and he's not a wrestler. So if you can figure it out, folks, we'll give you a prize. I'm not going to say what the prize is yet, but we'll give you a good price. How's that sound? Now, Bill, after this is over here, I'm going to have to find out what you do for a living because I don't even know. But we're going to have all our YouTube fans guess what you do for a living. No hints, all right? And anyway, if I gave you a hint, if I had him sit up and take his mask off, you would never guess he's a clown anyway. So you'll notice here I'm doing Cox technique, and I'm going up to about T12L1. There's a reason for that, because below that, he has a disc herniation. If I put my hand below where the disc herniation is, I could really, really set him off in a way that he wouldn't get off that table again, okay? So that's why it's important to be certified in this technique and to know what you're dealing with exactly. We have MRIs on Bill here, so we know exactly what's going on with his spine. So we're going to come over here and we're going to loosen up his right side as well along the spine, the QL. So again, folks, if you have a disc herniation, a disc bulge, spinal stenosis, degenerative disc disease, stop getting the injections. They're not going to do a thing for you. They're going to just minimize or mask your symptoms. Hands down, the best thing for any disc injury, any chronic injury to the spine would be chiropractic, but more importantly, Cox technique right here, which is what we're doing. A couple years ago when he had his first injury, this is the technique we did. I don't know if you remember that, Bill. Do you?
I do.
Yeah.
My audience might not.
Yes, the audience wouldn't remember. Our YouTube channel back then was in its infancy stages. How are we doing here? Any pain down into the legs?
No, not really.
Good. Okay, keep your legs straight. Raise one leg as high as you can. Okay.
Very high.
And down. And the other one. Okay, and down. Is one leg harder to raise than the other?
Initially, I tried to move the right leg, and it just clamped up.
It wouldn't move. Okay, we're going to test that again.
So it wouldn't move without pain.
Gotcha. On a scale of 1 to 10, when you raise that leg up, how was the pain? 1 to 10, 10 being the most pain.
When I got it raised up, it
Wasn't bad?
Yeah.
Try it now.
It was, the first attempt was a 10 and made me stop.
Okay. Oh, that's much better. And the other one?
That was really easy.
Okay, so that was a lot better.
Yeah. That was better for both, but I think you could see that the left was a lot better than the right.
Yeah, so I'm going to have you cross the difficult leg, the right leg, over the left. Yeah. Okay, uncross the legs, and we're going to try that again, raising one leg at a time. The other one? How's that?
I think the right one felt a little easier. The left one seemed similar.
Both felt equal, left to right?
More equal than before, yeah.
Okay. Cross that right ankle over the left one again. Uncross them again and raise them up one at a time. Okay, that looks easier.
That was much easier. And that
Good.
was easier too.
Good. Okay. Turn over on your back. Yeah, with the mask on, they won't recognize you, though. All right, folks. Again, if you can guess what he does for a living, you're going to get a prize. Cross your arms in front of you. Give yourself a big hug. Tuck your chin down. Do a half a sit-up. Take a deep breath in. And blow all the way out. tuck a little bit more now. Yep. There we go. Hands up in the air. So we just saw you yesterday. Relax here. Okay, do me a favor, roll onto your side and sit up and face this way.
This side?
Yep. So since Bill was really nice to allow us to shoot this video, we're gonna give him a free laser treatment, so I want you to sit right here. Yeah. You can put your feet flat on the floor. So we're just going to do a real quick laser treatment. This is going to help reduce the inflammation and take the edge off, just make his weekend more comfortable. He was really nice to allow us to film this treatment, so we're going to do that for him here. Okay, you're not going to feel anything here, Bill? Okay. And I know both sides are uncomfortable, so we're going to laser both sides here. This is just going to take a few minutes here. So many of you have seen me do videos on cold laser. This machine is a game changer, really a game changer. It does so much more than just alleviate pain. And reduce inflammation. There's just so many things you can use this laser for that we won't get into all of them. But if you guys have any questions as to, I don't know, maybe a condition you're suffering from that and you think laser could be helpful for you, or if you have any questions at all about herniated discs, disc fissures, Cox technique, or cold laser, feel free to comment below. And thanks for tubing in, folks. Thanks for letting us show people how it's done.